Hi, my name is Dr. Erin Walborn-Sterantino, and in this video, we're going to talk about evaluating, treating, and managing tinnitus. Now, again, this presentation is for general informational purposes only. It is not a replacement for coming in and seeing us to obtain an individualized tinnitus treatment plan. So, when do you decide that you need to be evaluated for tinnitus? Well, and who do you see, right? That's always the great question. So, if you have bothersome tinnitus that's affecting your sleep, your concentration, your mood, or daily life, if you have tinnitus with self-perceived hearing loss, and or if you have questions about your hearing, tinnitus management or treatment options, you want to start with an audiologist. Okay? If you have sudden hearing loss, within like just literally suddenly, if you have pulsatile tinnitus or a sound that beats with your heartbeat, if tinnitus is primarily in one ear and it's something new that's accompanied by hearing loss or dizziness or ear pain or drainage, or tinnitus following a head or neck injury, you more likely than not would want to be seen by your primary care or an ear, nose, and throat doctor. Now, if you start with an audiologist who's trained in tinnitus management, we would be referring you over to see another specialist if we did find any of those causes that we just talked about. So, what can an audiologist do versus a physician? An audiologist is going to perform a comprehensive audiologic evaluation. So, what we're doing is we're looking for hearing loss and other associated factors that might be contributing or making your tinnitus more bothersome. We're going to look at how tinnitus is affecting your daily life, which is why you have to fill out all of those questionnaires that we will give you should you call our office and ask for a tinnitus evaluation. We provide educational counseling and individualized support counseling. So you would end up with an individualized tinnitus treatment plan that would be specialized just for you. We provide evidence-based tinnitus treatment options. We monitor your progress and adjust the treatment plan over time. And we will definitely refer you for a medical eval when other warning signs or other health concerns are present. So we often coordinate care with other specialists when appropriate. So what's a physician going to do? Well, a physician is going to perform a comprehensive medical evaluation, not necessarily of your auditory system. They can identify and treat underlying medical conditions that might be associated with tinnitus. They can determine if additional testing may be necessary, such as an MRI or imaging, or maybe laboratory tests. They can review your medications to determine is that a contributing factor, and they will refer you to an audiologist for hearing evaluation and evidence-based tinnitus management. They also coordinate care with other specialists when appropriate. Now, if you don't know who to see, you want to ask when you call the clinic that you want to see a tinnitus specialist because you'll receive all of the things that I just talked about. If you are coming because you have hearing loss and you have non-bothersome tinnitus and you don't need that addressed, then you do not need to have a full tinnitus evaluation, and you can see any audiologist in the practice and they can walk you through the basics of your auditory system and determine if you need a hearing aid. So what does a comprehensive evaluation of tinnitus look like? So here is where we're going to take an extensive case history. And in that case history, you are going to have many questionnaires to fill out. We use things like a tinnitus handicap inventory, a tinnitus functional index. We use an anxiety and a depression screener. We use some type of suicide risk screening tool and a test to look at if you have any obsessive compulsive tendencies. We provide an audiologic evaluation and a tinnitus evaluation, and then we will refer you out for a medical evaluation when indicated. So components of a tinnitus evaluation that includes an audiologic evaluation it's a little bit more than just the beep test. We are doing a series of tests like looking in your ear and your basic hearing test with speech testing, with a tinnitus pitch match and loudness match, maybe with some middle ear testing. It really is we determine it when we see you because we need to get a very complete picture of your auditory system. So there may be some high frequency hearing testing that we also do. So this allows us to really look at all of the mechanisms of your ear to determine what is a contributing factor and what might not be. And so at that point in time, we would go over evidence-based treatment options with you. I'll briefly run through them with you here. Again, this is not for you to create your own individualized tinnitus treatment plan right now, but this is to give you an idea of the things that are evidence-based and out there. There are things like sound therapy and hearing treatment. If you have hearing loss, we treat your hearing. There's cognitive behavioral therapy, there's mindfulness-based approaches, there's bimodal neuromodulation, and then there's combined approaches. So let's take each one a little bit at a time. Well, what is sound therapy? This is not masking. You might have heard of masking in the past. Masking is where you take another sound and you turn it up so loud you can't hear your own tinnitus. But the problem with that is you can't teach your body that it's not dangerous, that it's just a twig snapping in the woods, that it's neutral. So what we try to do as sound therapy is we try to find a pleasing sound for you that you can set very low so that you have something else to listen to when you are experiencing tinnitus distress. And so this will allow us to lessen how loud you hear the tinnitus, but just by a little. We're not trying to make the tinnitus completely go away because we want to teach your body that it is not important, that it doesn't need to subconsciously react and think that it's dangerous. And so sound therapy can be delivered through many different ways. It can be delivered through environmental, like using a fan in your environment, tabletop sound machines, wearable sound generators that look like little hearing aids themselves, and then there's personal sound-based digital therapeutics. Tips for this are choose a sound you like, consider the volume, set low enough to make tinnitus less noticeable, but without interfering with conversation or awareness of your surroundings, and where you can still hear your tinnitus so you can learn to habituate to it. We use it to reduce contrast, so we can help your tinnitus blend into your environment so it's less noticeable, but not to cover it up completely. And you only need to use the sound therapy when you need it, when you're actually feeling that you're in distress. So you might find it most helpful during quiet activities or when you're trying to concentrate or at bedtime. And some of the studies, systematic reviews that were done, included 8 randomized controlled trials of 590 adults. And this was showed hearing aids, sound generators, and combination devices were all associated with reduced tinnitus. And no device type was shown to work better than another. And these studies did not provide enough information to determine whether it was a placebo effect, education alone, or no treatment. I will say I have worked with many patients who have hearing aids that were fit elsewhere. And one of the main things that is a crucial factor is whether they were VeriFit or speech mapped to determine that they were fit to you appropriately, especially for the treatment of your tinnitus. It is the gold standard in audiologic care when you wear hearing aids to have them verified and validated. And that is done through what we use is VeriFit speech mapping. And that is very important because that can literally change how well someone does with their sound therapy and helping with their tinnitus. There's also educational counseling that audiologists can provide, and different organizations and different audiologists may provide different ones. I was trained in tinnitus retraining therapy that combines directive counseling with low-level sound therapy, and that can be done through hearing aids or other ways of getting sound to you. There is tinnitus activities treatment, which that focuses on thoughts, emotions, hearing, sleep, and concentration, and it is using individualized counseling and practical activities. And then there's progressive tinnitus management that is from the VA, and they combine audiology and behavioral health strategies. And there is a lot of information on that online. Cognitive behavioral therapy approaches. This is where cognitive behavioral therapy focuses on unhelpful thoughts and behavior patterns, so recognizing what those are, learning practical coping and problem solving skills. developing greater awareness, acceptance, and psychological flexibility, and practicing new skills in everyday life. And the goal here is to help people develop more helpful ways of thinking, feeling, and responding that can reduce distress and improve your overall well being. And so this can be delivered by therapists in person or online through apps. There's a lot of apps out there right now, or digital therapeutics. So there is traditional cognitive behavioral therapy, and then there's mindfulness-based cognitive behavioral therapy. Both have been fairly successful. Mindfulness-based cognitive behavioral therapy is bringing in Eastern mindfulness meditation traditions to help work and manage the dysregulated nervous system. So effects of CBT-based approaches in tinnitus, another systematic review, and this included traditional cognitive behavioral therapy, acceptance and commitment therapy, and then the mindfulness-based cognitive behavioral therapy. And they did it on people who had bothersome tinnitus lasting at least 3 months. And this studies, or the systematic review of studies, showed that reduced tinnitus distress and its impact on daily life. There was a statistically significant reduction of tinnitus distress using these techniques. There was reduced symptoms of depression, and the benefits are found across multiple approaches that were used in both in-person and online. There are mindfulness-based approaches, and this is paying attention to the present moment, observing thoughts and emotions without judgment, developing acceptance and self-compassion, and building awareness and resilience through regular practice. And the goal of mindfulness-based approaches are to help people change their relationships with their thoughts, emotions, and difficult experiences, and it's to regulate your nervous system. Again, this can be delivered in person through telehealth, mobile apps, and evidence-based digital therapeutics. So some examples of daily mindful practices are mindful breathing, body scan, present moment awareness, mindful movement, loving kindness meditation, open awareness, mindful listening, and gratitude. And we will do some of these practices in another video with you to help you become more aware of how to use them in your daily life. But evidence-based mind-body practices are mindfulness and mindfulness-based stress reduction. That is an 8-week course that focuses on teaching meditation skills and communication skills and looking at perceptions and how to manage stress in a different way. There's breath work, there's yoga and Tai Chi, there's biofeedback and guided imagery and hypnosis, all of which have been found to be effective mind-body based practices. And again, a little bit about the MBSR course, since that is the class I also teach. This is taught around the world. And it was developed in the 70s by a molecular biologist who was working with people with chronic pain. And the studies showed that this really did effectively reduce distress. So some studies that were done on MBSR and MBCT. This was a systematic review. And this included randomized control trials and prospective studies. 6 out of 7 studies found that mindfulness significantly reduced tinnitus-related distress. Participants often reported better quality of life and emotional well-being. Anxiety and depression were frequently improved. And people felt better even when the tinnitus loudness itself did not change. And then there's bimodal neuromodulation. So, bimodal neuromodulation approaches focus on pairing sound with a gentle stimulation of another sensory pathway. And so you're using 2 forms of stimulation in a coordinated, repeated pattern. And this promotes changes in neural activity and sensory processing associated with tinnitus. And it can reduce tinnitus-related distress and its impact on daily life. So the delivery of bimodal neuromodulation right now is delivered through specialized prescription devices. The current one on the market that is the only one FDA approved at this time is called Linear, and they're using stimulation of the tongue along with sound. Now, there are several others that are still being researched. They are not FDA approved yet, and we will keep you updated on those as they become available. So effects of bimodal neuromodulation and tinnitus, another systematic review. And actually, this was not a systematic review. This was done by Neuromod themselves, the owners of Lanier. And what they did is they took 112 adults with tinnitus. And first, what they did is they gave them 6 weeks of sound therapy alone. And they followed that by 6 weeks of the sound plus tongue stimulation. And in this study, they only tested those people who had moderate or more bothersome tinnitus with the sound alone and then the sound plus tongue stimulation. And they found that sound plus tongue stimulation was more effective than sound therapy alone. They found that treatment was well tolerated over multiple different studies and no device-related serious adverse effects were noted. And this study and these findings allowed the company to get FDA authorization to use Lanier as the first bimodal neuromodulation device for tinnitus, which we do have in our office for you if you are a candidate. And combination approaches, this is where, because we know tinnitus is not from one main identifiable cause, oftentimes more than one treatment approach is needed. And this is where we address many different factors that contribute to tinnitus and its impact. So we look at all of your studies and we look at where it's affecting you in your daily life, and then we tailor the treatment and combine things to help you in your own life to improve your overall quality of life. And so this can include using sound therapy, using hearing aids, using cognitive behavioral therapy, using mindfulness or meditation approaches, using bimodal neuromodulation, using sleep management or breath work, or treatment of other related conditions like treatment of your TMJ or your head or neck issues. So depending on your needs, these approaches could be self-guided or delivered by one or more healthcare professionals or used altogether. And so another systematic review was done on these combined approaches, and they looked at combining cognitive behavioral therapy and sound therapy with sound therapy alone or other comparison treatments. And they found that the combination of cognitive behavioral therapy with sound therapy reduced tinnitus related to stress and handicap more than sound therapy alone. And they were seeing improvements on the tinnitus handicap inventory, which is what I talked about in the beginning about we try to help you go from bothersome to non-bothersome. And so this is the evidence-based treatment options that are available, and we use all of them. And I'm going to walk you through some case studies, because there's not one right way for anybody, right? And so what we have to determine when we see you in person is what is the best way for you. So in this study, there's going to be 5 of them in total. This was a 45-year-old male who had normal hearing, except in the very high frequencies. He did not have hearing loss that affected his ability to communicate. He also had possible jaw or TMJ problems, clenching his teeth, that contributed. He came to us with a tinnitus handicap inventory of a 76 out of 100, which is a severe. His anxiety was severe, 15 out of 21, and his depression was a 16 out of 27 and scoring a moderately severe. The intervention for Adam was simply a counseling session, a one-time educational counseling session, which included items of this talk and then items of the nervous system regulation and safety talk. And that his outcomes showed he went from a 76 severe to a 17 mild. Anxiety went from a 15 severe down to a 5 mild. And depression went from a 16 moderately severe down to a 10 moderate. In this next case, this was Larry, who was a 64-year-old male who had normal hearing sloping to a moderately to severe hearing loss, and he had tension in his head, neck, and jaw. He came to us with a baseline of 66, a severe tinnitus handicap. He had mild anxiety and minimal depression. So Larry went through several different interventions. He used hearing aids. He then added on cognitive behavioral therapy. He did a mindfulness-based stress reduction course, and he continues to daily meditate. His tinnitus handicap inventory went from a 66 down to 2, no handicap. His anxiety went from a mild to 0, none. His depression was minimal and it remained minimal. Case study number 3 is Heidi. She is a 62-year-old female with a normal sloping to mild moderate hearing loss, and she had some stress in her life. Now, she came to us with a moderate tinnitus handicap of 44 out of 100, and she did not have any anxiety or depression. So she chose not to use hearing aids. She wanted to just try linear. So that's what she did. And she went from a 44 baseline down to 12, no handicap. And again, she had no anxiety or depression. Case study number 4 is Anne, a 73-year-old female, normal sloping to mild moderate hearing loss. She had some clenching of the teeth or TMJ and stress. Her tinnitus handicap inventory when she came to us was a 24, a mild. She had minimal anxiety and minimal depression. So intervention for her, we started with hearing aids and she was doing very well. And then she started to have to take care of her elderly mom. So as we looked at her outcomes, her tinnitus handicap inventory went from a 24 down to a 6, so no handicap. But look at her anxiety. Her anxiety had gone up, and it went from minimal to mild, and that was directly related to the stressors of having to take care of her mother, but that did not affect her tinnitus. So, and her depression remained at none. And our last case study is a 61-year-old female who also had normal hearing, just a very borderline normal at the high end. She had had recent dental work and a lot of stress in her life. She came to us with a tinnitus handicap inventory of a 40, a moderate. She had minimal anxiety and minimal depression. And she chose to use apps to help her. So she used a cognitive behavioral therapy app. She used an over-the-counter sound therapy app. And then she used a meditation app to help her with stress management. And her tinnitus handicap inventory went from a 40 down to a 14, and her anxiety and depression remained minimal. So those are the case studies, and I show you those because, again, first we're trying to take you from bothersome to non-bothersome tinnitus, and there is not one right way to do it. So you will absolutely obtain from us when you come see us for a specific tinnitus evaluation, an individualized tinnitus treatment plan where you get to be the driver of what you want to try first, and then we can, give you suggestions. And then you get to decide what you start with, and then we'll be monitoring you throughout. And then we get to decide, hey, you need a little bit more support. What do you think of this? And then, you choose to do more to help or not if you need it or don't need it. So thank you so much. If you do have any questions about the mindfulness-based stress reduction class, you can find my information at MBSR NY. There are some free guided meditations on there. And then to schedule an appointment with us to see a tinnitus specialist, you would just call the phone number at 283-6111. We have audiologists trained in tinnitus in our Saratoga, Queensbury, Hudson, and Rensselaer locations. If you would like to support the American Tinnitus Association, this is something, an organization that supports and raises money to support tinnitus research and to help educate providers and patients, and they have some really great information online as well. So thank you so much, and we hope to see you in our office.